The moment you start worrying about your knee before an approach shot, golf has already taken something from you. You step out of the cart on a tight par 4, you've got, I don't know, 148 yards to the pin, good 9-iron. It's a good number, you're comfortable taking that shot, you have a great lie. But the problem is you're not thinking about where the flag position is. You are thinking, if I swing wrong, my knee is gonna light me up and this round is gonna be over and it's not gonna be fun. And that moment is when a lot of good golfers make a mistake. They end up blaming age, they buy a brace, they start taking a couple of anti-inflammatories before the round and who knows, maybe at the turn. They then hope for the best. Don't do that. Because inside knee pain in golfers is often not a random occurrence. It is usually a very specific pattern involving the medial meniscus and early arthritis, and also the way that your swing is repeatedly loading your trail knee. Today, I'm gonna show you what might actually be happening and the one 5-minute habit that can change how your knee feels before your next round, and also how to avoid spending real money on the wrong treatment. If you still expect to play 18 holes without worrying about every single swing, stay with me right here. Because my name is Dr. Gayan Poovendran. I am a medical doctor, but I'm also a golfer. Now, look, I'm not a scratch golfer. I'm not very good, but I am a golf enthusiast, which means that I love to get out there and I somehow find a reason to keep going back to the course, even if I only hit one good shot the entire day. Even though I'm not a good golfer, I understand what golf means to you because it means the same thing to me. It's not just exercise, it's competition, it's being out there with your friend group. It's the place where you get to shut everything else off and focus one shot at a time. Now, over the last 15 years, I have helped thousands of golfers protect their knees and make more informed decisions about their care. So if you want clear, golf-specific guidance, not generic advice for just active adults, subscribe and follow this channel. Every single week, I break down knee pain, golf mechanics, joint longevity, and regenerative medicine for golfers who still expect a lot from their body. All right, let's talk about why that knee starts talking to you at the worst possible moment. Here is a guy that I see all the time. He was actually in my office this morning. He's 52 years old. He is very successful at his career. He's a type A personality guy. He also a competitive golfer, which means he's good, not just that he likes to get out there. He's used to being the guy in the foursome who can play all day, he can make the bets interesting, and he can also take a little bit of chirping without blinking. Then somewhere in the last couple of months, his trail knee started to ache. And at first, it's only after his round. Then it starts showing up around hole 12, and eventually he's now stepping out of the cart for an approach shot that he has hit 1,000 times, and he starts wondering whether one aggressive swing is going to ruin the rest of his day. That changes the way he plays. He stops finishing his swing. He starts protecting his knee without even realizing it. He realizes, or his follows through starts getting shorter. His confidence starts to go along with it. Often, when we work this up properly, what we find is degenerative medial meniscus tears and early arthritis, and very likely a combination of the two. Meniscus injuries and knee osteoarthritis are some of the most common sources of knee symptoms in golfers, especially as the joint has accumulated years of loading through swings and rounds and walking. Now, here's the part that most orthopedic surgeons miss in golfers. Yes, they look at the knee and they look at the MRI, but they don't always see the golfer behind the knee. Your trail foot plants, your hips begin to rotate, your knee has to manage compression, rotation, and force over and over again through every single practice swing, every range session, every round of golf, every uneven lie, and every downhill walk. Think of the medial meniscus like the first cut of the rough, right? When it's healthy and supported, you can take a nice aggressive shot and trust the ground beneath you. If you keep taking divots out of the same patch without fixing what created the problem, eventually you end up starting to hit off of a thin lie. Yes, you can still play, but it ends up costing you more, right? More discomfort, there's a little bit more hesitation, you start second guessing your shot, and then what happens? You have less confidence. Now, there are a few signs that you should absolutely not ignore, so let's go through those first. If you have a deep ache or sharp pain on the inside of your knee after a round, if you have swelling later that day or the next morning, if you have catching, locking, or if you can't fully straighten your knee. And then finally, if the knee feels like it's going to give out or it doesn't feel like it's very stable underneath you. If you have true locking or repeated swelling and instability or pain that's affecting your everyday life, not just golf, look, that is a reason to get a proper evaluation. But for many golfers, there's a lot that we can do before the answer becomes, well, I guess it's just time to quit playing hard. So let's make this simple. I'm not going to give you a laundry list. That's not 10 things that you have to like save on your phone and then never look at it again. It's one behavior. Warm up for 5 minutes before every single round, every single time. That is the habit that I want you to leave with today. Not static stretching in the parking lot while you answer your email, not 3 half-hearted practice swings besides the first tee. 5 minutes of deliberate, intentional, golf-specific movement. Here's why. Let's talk about performance. If you do this warm-up, you walk to the first tee with your hips and legs and torso already moving. You're not showing up to the first tee expecting your knee to handle your first full-speed swing all by itself. You get to focus on the lie, the wind, the target, the draw, or the fade that you want to put on the ball, not whether your knee is going to complain about it. If you don't, well, then you end up asking a stiff, cold joint to go from your car or your office chair to a full rotational load that's 4 times your body weight almost instantly. That first hard swing or that first hard approach shot after getting out of the cart, it becomes a gamble, not just a golf shot. There's no shame here in warming up. It's just a different setup for your round. Then let's talk about longevity. If you do this warm up, then you are giving your muscles a chance to share the work. There's better movement and better joint control, and that can help your knee manage load more effectively. That matters when you're trying to preserve the golf now for the next 5 to 10 years. And if you don't do this, well, then the knee ends up absorbing the same force with the same poor preparation, and the meniscus and the arthritis get worse, and they don't usually announce themselves in one dramatic moment, right? They accumulate quietly over thousands and thousands of swings and steps. And then let's talk about your identity, right? So if you do this warm up, you are acting like a golfer who still expects to be a player in his group, I don't know, a decade from now. You are protecting the version of yourself who attacks the shot, who doesn't lay up, who is thinking about golf instead of negotiating with their knee. And if you don't, well, then you become the guy who is slowly managing his knee. You start skipping rounds and you start riding the cart when you would rather walk. You take the safer swing, you lay up, you don't go for it. You stop signing up for the yearly golf trip with your boys because you're not sure if you can handle 2 or 3 days of golf in a row. But look, that's not inevitable, but it is a direction, and you can change that direction. And then let's talk about return on investment, because we're all successful guys and we all want to make sure that what we put in, we get something out of, right? If you do the warm up, you're investing 5 minutes before a round, and that's investing in a knee that carries you through your work, your family life, your travel, your golf, and let's be honest, it's probably the least expensive performance decision that you could ever make. If you don't do this, you can end up spending a lot of time and a lot of money trying to buy your way out of a problem while skipping the foundation that gives every other treatment a better chance to work. This is not a lecture. I know doctors like to lecture, but you understand ROI. I think that 5 minutes of investment is a good trade. Now, I've built a full 6 movement sequence into the free guide at readyforteeoff.com. So you can go download it before your next round, you pull it up on your phone, and again, it takes 5 minutes. But I want to give you one move that you can do right now before you download it so you can start immediately. This exercise is called split stance rotations. What you're going to do is you're going to do 1 set of 6 repetitions per side. You're going to get into a comfortable split stance and you're going to rotate your torso with control. What this is going to do is it's going to help you rehearse a golf-like rotation before you ask your body to create it at full speed. The other 5 movements and the exact setups, repetitions, and cues are in my free guide at readyforteeoff.com. There are no strings attached. It's just a gift to thank you for watching these videos. So go download it and come right back. I put together that free guide because I want you to stop walking straight from the car to the first tee like you're going to a business meeting. It's just 5 minutes of squats, rotations, and leg swings that they can help your knees show up ready for the round it has to play. Now, that warm-up is definitely non-negotiable, but then I also have 2 other supporting levers that are pretty easy to get into and are pretty low barriers to entry. The first is build a little more strength around your knee. So look, your glutes and your hips, They help keep your knee from drifting inwards when you load and rotate. Think of them kind of like those alignment sticks of your lower body. When that support system is working, the knee tracks more cleanly. When it is not working though, the inside of your knee often ends up paying the price for it by caving in. So by doing these exercises 3 times a week and spending 10 minutes doing these with a resistance band, you can help make that stronger so you don't have to suffer these problems. The first exercise is lateral band walks. You are going to do 15 steps in each direction. The second exercise is terminal knee extensions. You're going to do 12 per side. And then the last one is a single leg bounce with light golf posture, and that's going to be done 30 seconds per side. If you notice, these don't require a home gym or a personal trainer. All you need is an exercise band, 10 minutes, and enough honesty to admit that your knee cannot keep doing all the work forever. And if you need suggestions on an exercise band, I have one linked in the description in the video below. Your knee doesn't just quit on you because you turned 50. It doesn't care about the calendar. It starts to struggle when the muscles that are supposed to support it stop doing their share of the job. By exercising them properly and regularly, you can help take some of that load off and help protect your knee. The second low barrier to entry lever that you can pull is take a hard look at your swing mechanics. Now look, you don't need to rebuild your swing. You don't need to spend thousands and thousands of dollars with a swing coach. You may simply need to stop making your trail knee do all the dirty work. I have seen golfers that improve their comfort and decrease their pain with very, very small changes. Whether that's a slightly wider golf stance, a more controlled backswing, they work on their hip mobility, or they're working with a golf-specific physical therapist that works on a couple of these things. One patient of mine who was a 58-year-old guy, he was a 5 handicap coming in with knee pain. We got him set up with a golf therapist, and in the end, he maybe ended up giving up 3 yards of distance on his driver by shortening his backswing a little bit, but what he gained was the ability to finish 18 holes without pain, and he didn't drop a stroke. I think that is a trade that most smart golfers were willing to take. Now, if the knee stops screaming at you, you may also finally be able to beat your buddy Carl, who has been chirping at you for years. Sometimes there are medical outcomes, and then sometimes there's outcomes that really matter, right? So I'm a regenerative medicine doctor, so where does regenerative medicine fit in this whole picture of everything? Well, think of knee care in 3 lanes. Lane 1 is conservative care, which is your warm-up, your strength, your swing mechanics, load management, physical therapy, all the things that we just talked about that address the actual movement problem underneath. Lane 2 is where I live, which is regenerative medicine. Those are options like platelet-rich plasma or PRP or stem cell injections. These are considered carefully for the right patient. And then lane 3 is surgery, where I work really hard to keep you away from. Those are for the cases that have severe mechanical problems or severe damage or symptoms that do not respond well to well-executed conservative care. Regenerative medicine, though, is not magic. It is not something that you do because you're impatient, and it is not a substitute for taking care of the mechanics that got you here. But for the right golfer, often someone that has mild to moderate arthritis, they have persistent pain despite a good conservative plan of physical therapy and movement, and they have a clear goal of preserving function, PRP may be a reasonable part of the conversation. Evidence supports PRP as an option that can improve pain and function for some people that have mild to moderate arthritis in their knees. Although the results vary and it is not right for every single knee, it does have a lot of promise. Now, here's how you avoid wasting money with PRP. Get a real workup first. A good workup includes your history, how your pain behaves during and after golf, a proper physical exam, appropriate imaging when needed, and an honest conversation about your goals. The conversation should have nothing to do with what is the most expensive, exotic thing that I can inject into you. When you're at this consultation, ask instead, what is actually driving my pain? What have I already tried? What is my knee realistically capable of? And what gives me the best chance to keep playing at the level that I want to play at? If you are bone on bone with major loss of joint space, if your knee is truly locking, or if instability is really a significant problem, a biologic injection like PRP or stem cells may not be the right answer for you. Now look, that's not necessarily bad news, it's just useful information. The right treatment is the one that matches the knee in front of us, not the one that has the best marketing behind it. All right, that was a lot of information. I hope you're still with me, so let's bring this home. If you're getting out of the cart and you're worrying whether your knee can survive an approach shot, do not dismiss it as age. Inside knee pain in golfers can reflect a pattern of medial meniscus wear and early arthritis and repeated stress from the way that your knee handles your swing. Your first move is not to ignore it, and it's not to panic. It is to get proactive. Here is your plan. First of all, the most important thing, Start warming up 5 minutes before every single round. Add a simple band routine a few times a week for 10 minutes at a time to strengthen your knee muscles to give your joint a little reprieve. Work with the right professionals to reduce unnecessary torque in your swing around your knee. And then make sure you're getting a real evaluation if you have swelling or locking or instability or pain that is changing your life. And finally, consider regenerative medicine only after you understand what you are treating and why you are treating it. But again, the most important thing, do the warm-up. So go grab it at readyforteeoff.com. Download that free 5-minute golf knee warm-up guide and use it before your next round. Then pay attention. Pay attention to that first tee shot. Pay attention to the approach shot after you get out of the cart. Pay attention to whether you're thinking about your knee or you're thinking about the flag position. That is the goal. I'm Dr. Gayan Poovendran. Subscribe to this page if you want to protect your knees and you want to protect your game. Keep following this advice and I'll see you next time, pain-free on that fairway.